Welcome to the deep dive. You know, if you've ever tried looking up health information, maybe specifically about something like varicose veins, it's, it's easy to feel completely swamped.
Absolutely. It can feel like wading through just tons of technical stuff.
Right, just this mountain of jargon. But don't worry, that's why we're here today. We want to cut through that noise, give you, and maybe your caregivers too, a kind of clear path, a shortcut really, to understanding what's going on.
Yeah, that's exactly our plan. We're going to dig into varicose veins, and we're using the very latest guidelines from the top experts. Think groups like the Society for Vascular Surgery, the American Venous Forum, the big names.
Okay.
And the goal here isn't to make you a medical expert overnight. It's about giving you solid, practical knowledge so you can walk into your doctor's office feeling, prepared.
Confident.
Exactly. Ready to have a really informed chat.
So first things first, varicose veins. What are we actually talking about in simple terms?
Okay, so think of it this way. Varicose veins are basically veins that have gotten stretched out, or dilated is the medical term, and they often get kind of twisty and winding. That's what tortuous means.
Okay.
Imagine your veins are like little rivers carrying blood. Healthy veins, they flow smoothly, but with varicose veins, the walls weaken, parts bulge out, get twisted.
Like little kinks in the hose?
Sort of, yeah. It makes it harder for the blood to flow properly back up towards your heart. It's actually really common. Doctors might call it clinical class C2.
C2, okay.
Yeah, it just means the veins are visible, maybe causing some issues, but haven't led to like major skin problems yet. It helps them categorize things.
Got it. And what does that feel like for someone? What are the key signs, that people should maybe watch out for?
Well, there's a common cluster of symptoms people describe. We sometimes use the acronym HASTY.
Hasty?
Yeah, HASTI. It stands for heaviness in the legs, maybe some achiness, swelling, sometimes throbbing, or even itching around the veins.
Okay, heaviness, achiness, swelling, throbbing, itching, hasty.
Exactly, and these aren't just, minor things. They can really get in the way, make standing or walking uncomfortable, just impact your day-to-day life.
That sounds really disruptive. So if someone's nodding along thinking, yeah, I feel that heaviness, that achiness, what do these new guidelines suggest? What's the path forward?
Well, the big takeaway, and this is really empowering, is that varicose veins are definitely manageable. There isn't just one answer. There are several really effective ways to treat them.
Okay.
And what's really shifting, based on these guidelines, is a strong preference now for office-based procedures.
So not necessarily needing full hospital surgery.
Right. It's often preferred because, patients tend to be much happier with the experience, the recovery is usually faster, and often it's more cost-effective too. You get back on your feet quicker.
That sounds like a big plus.
It really is. Now, traditional surgery is still an option. It's on the table, but these modern, minimally invasive techniques, they're widely available now and proving to be great long-term solutions.
That's a really positive shift, focusing on comfort and speedier recovery.
Now, what about compression stockings? That's often the first thing people think of.
Yeah, they definitely have a role. Compression stockings are good for helping with the symptoms, that hasty feeling we talked about. And they're often recommended right after a procedure, maybe for about a week or so.
Yeah.
Because they can really help reduce pain during that initial healing.
Okay.
But, and this is important, if you have symptomatic varicose veins, meaning they're causing you those hasty issues, just relying on stockings alone might not be the best long-term fix. An actual procedure is often better for lasting relief.
Right. So stockings help manage, but a procedure might fix the underlying issue.
Pretty much. And it's also worth mentioning there are some medications too, things like micronized purified flavonoid fractions, a plant-based thing, or ruscus extracts. They can also help ease some of those symptoms.
Interesting. It really seems like the approach is becoming much more tailored, doesn't it?
It really is. More personalized, less one-size-fits-all. Okay, so thinking about after a procedure then. What about follow-up? People often hear about getting ultrasounds to check things. What do the guidelines say now?
This is actually a really interesting point and potentially reassuring for a lot of people. For the average person who doesn't have any special risk factors and isn't having new symptoms after their procedure, getting a routine early ultrasound just to check for blood clot extension, doctors call it RTE, it's often not recommended anymore.
Oh, really? So not automatic checks for everyone?
Exactly. It's a shift away from doing tests just in case towards being smarter about it. It reflects a better understanding of the actual risks. Now, of course, if you do develop new symptoms like sudden pain or swelling, or if your doctor considers you high risk for clots for some other reason, then yes, an early ultrasound is definitely still important.
That's a really crucial distinction. Smarter care, not just more care.
Yeah.
Okay, so wrapping things up, what's the big picture for you, the listener?
The big picture is don't feel overwhelmed. Varicose veins are manageable.
Right. And there are effective treatments, often these minimally invasive office-based ones we talked about.
Absolutely. Compression stockings can help with symptoms, especially after treatment, and some medications might offer relief too, but for long-term symptomatic relief, intervention is often key.
And remember that advice about follow-up ultrasounds may be not needed unless there's a specific reason.
Exactly. The key here is feeling empowered. Your own preferences matter hugely.
What do you mean?
Things like, what are your potential out-of-pocket costs? How much discomfort are you willing to tolerate during recovery? How quickly do you need to get back to work or your usual activities?
Oh, I see. Those practical things.
Yes, those are really important factors to talk through openly with your doctor. They're your partner in figuring out the best path for you.
That makes so much sense. Knowing your options, knowing what questions to even ask your doctor, that really is the first step to taking control, isn't it?
It absolutely is.
So, maybe the thought to leave you with today is, based on what you've heard, what's one new question you'll bring to your next conversation with your healthcare team?